If you are working in an English-speaking environment, you know how tricky it can be to greet a patient in English. Today, I'm going to share with you how to show empathy, reassure as appropriate, ask for consent, and how to use questions politely in English when clerking a patient. Let's go. Hi, I'm Alexia and I'm a senior teacher at SLC. Today, I'm going to share some ideas with you on how to greet a patient. If you would like help with this topic or topics similar to this, why not check out our English for Doctors course, where you can find the English you need to help you work and study in an English-speaking environment. Let's get started. What should I consider when greeting a patient? Some aspects that you need to bear in mind when greeting a patient are using an appropriate level of formality. You should try to appear professional, but personable and approachable too. It is important that you explain your role when greeting a patient, so that they know what type of healthcare professional they are with. Try to put the patient at ease and gain verbal consent from the patient. So let's start with greeting a patient. Here we have some simple and clear introductions. What phrases could you use to introduce yourself and your role? Hello, my name is Dr. Smith. I'm the surgeon on call today. Hello, I'm Dr. Smith, one of the ward doctors on duty this morning. Hello, I'm Dr. Smith, one of the GPs here at the practice. In these examples, we can see that the language is professional and appropriate to the situation. The doctor's name and role is clear for the patient to understand the situation. Let's compare these to this example. Hello, I'm Steve and I'll be helping you today. We can see that the introduction is too informal and unprofessional. Creating a good first impression with your patient is important to help create rapport and put them at ease. We can also see that the role is not stated. The patient needs to know your role from the very beginning of your interaction. Putting a patient at ease. Patients are often feeling anxious, concerned, embarrassed, or other emotions, as well as possibly feeling quite unwell. It is important to try and put your patient at ease early on in your interaction. In order to try and build rapport with the patient, it is important to show empathy and reassurance early on in the consultation. Here are some examples of how to do that. That must have been very frightening for you. You did the right thing. I understand you feel bad about the accident, but try not to worry too much at this point. I think it's important to focus on what we're going to do now too. Patient consent means a patient must give permission before receiving any kind of medical treatment, test or examination. This is important in helping build trust and understanding between the doctor and patient, as well as reducing risk for both the doctor and the patient. Gaining consent will be necessary early on in the conversation and can also help you to build rapport with the patient. Let's take a look at some examples. What questions could you ask when asking for consent? Is it okay if I? Is it okay if I ask you some questions about your family history? Is it okay if I ask you some personal questions? If that is okay with you. I'd like to ask you some questions, if that's okay with you. I would like to ask you some questions about the pain, if that's okay with you. If that's all right. I'd like to examine your leg, if that's all right. I would like to examine your wound, if that's all right. Would you mind ing? Would you mind unbuttoning your shirt? Would you mind lying down on the bed? Would you mind if I? Would you mind if I take a look at your leg? Would you mind if I take a look at your son's foot? Clerking a patient is the first contact a healthcare professional has with a patient. It provides essential information about the patient's health condition before being admitted to hospital. When clerking a patient, you will have to ask questions about common topics such as patient details, employment status, past medical history, presenting complaints, etc. It is important to use polite and clear questions. For example, can I get your first name? What's your surname? Can you tell me what brought you into hospital today? Can you show me where the pain was? Do you take any regular medication? How would you describe your alcohol intake? Is there any history of major illnesses like kidney or heart disease or diabetes? I'd like to do a full examination now, if that's all right with you. You may want to practice using the correct intonation when asking questions. For open questions, WH or information questions, use falling intonation. For example, what's your surname? For closed questions, yes/no questions, use rising intonation. For example, do you take any regular medication? Have a look at sentences 1 to 8 and decide if you think it is an open question and needs falling intonation or rising intonation for a closed question. Here we can see the open questions are highlighted in green and the closed questions are highlighted in red. Let's practice saying them with the right intonation. Can I get your first name? What's your surname? Can you tell me what brought you into hospital today? Can you show me where the pain was? Do you take any regular medication? How would you describe your alcohol intake? Is there any history of major illnesses like kidney or heart disease or diabetes? I'd like to do a full examination now, if that's all right with you. So let's recap what we've talked about in this video. When greeting a patient, introduce yourself and explain your role. Offer reassurance and empathy as appropriate and gain consent. Remember to use a level of formality appropriate to the consultation throughout. How do you greet a patient? Let me know in the comments box below. And if you found today's video useful, please like, subscribe and share. If you would like more materials like this one, whether you're a teacher or a healthcare professional working in an English-speaking environment, you can contact us by using the links in the description box below. Thanks for joining me today. See you next time.